agents, and they are going to come and present for you. I'm Sabrina Johnson. I'm the SSA director, and I'm over MUI and SSA. On down, the price is right.
All right, good afternoon. Like Sabrina said, my name is Nick Porkaziwa. I'm one of the investigative agents here with Medina County Board of ED. So we are going to start off with the MUI rule training portion, so that when we get into the data later, you have a better understanding of what we do and the categories and that we investigate. Okay, so what we're going to learn is what is a major unusual incident and the types of MUIs. A major unusual incident is any alleged, suspected, or actual occurrence of an incident as defined by rule. There are three categories of major unusual incidents, categories A, B, and C. The major unusual incidents are filed on an incident tracking system with Ohio Department of Developmental Disabilities. There's regional managers, intake people that are constantly going over our incidents as we enter them pretty much on a daily basis on Monday through Friday. I don't think they have anybody there on the weekends, but they're definitely watching them every Monday through Friday as we enter the reports. So we have our category A MUIs. These are like our highest level of MUIs, required to meet a preponderance of evidence through the investigation. The category A incident means that more likely than not the incident occurred. And category A investigations can be led by outside entities like law enforcement, children's services, Ohio Department of Health, BCI, what have you. And here's a list of our category A MUIs. We have the abuse categories: physical abuse, sexual abuse, verbal abuse, accidental suspicious death, exploitation, failure to report, misappropriation, neglect, prohibited sexual relations, and rights code violations. So our first category we're going to look at is physical abuse. That's physical force that can reasonably be expected to result in harm, does not have to actually result in harm. We don't have to have bruises or injuries. If it's witnessed or if it's reported verbally by an individual or witnesses, then we make the report. If an individual is slapped across the face by a family member, leaving a mark on the individual's face, staff drags an individual across carpeting to force him back into his room, causing severe rug burns. You want to take this one?
So sexual abuse defined by this rule is unlawful sexual contact with an individual served, including public indecency and importuning, I can't say that word, don't judge me, and voyeurism. The conduct equals sexual penetration, contact equals touching of an erogenous zone. Public indecency would be anything prohibited to do in public, like indecent exposure, having like someone expose themselves to an individual. Voyeurism would be being sexually gratified by watching others, and importuning is begging or harassing an individual, usually a minor, with persistence to engage in a sexual act. Verbal abuse, it's the use of words, gestures, or other communicative means, texts, emails, which texting is like a huge one that we see a lot now, to threaten, coerce, intimidate, harass, or humiliate an individual. An example would be staff threatens to beat up an individual if she tells anyone he broke the rules. Staff calls an individual a stupid retard because he refused to wash the dishes after dinner, causing the individual to flee the room in tears. An individual receives a text message from a neighbor threatening to burn the house down while you sleep. Accidental suspicious death. These are the means of death of an individual resulting from an accident or suspicious circumstances. This would be choking, drowning, drug overdose, fall, motor vehicle accident, suicide, and homicide.
And just to add to this, whenever there's a motor vehicle incident, if there's an accident, if any of the staff that work in our field are involved in an accident, we're asking everybody to make a report on that to make sure we're aware. Even if there was no injuries involved, we just want to make sure we know who all was involved in that accident, so we know if there's any follow-up that needs to be done.
Exploitation, the unlawful or improper act of using an individual or an individual's resources for monetary or personal benefit, profit, or gain. A staff person takes two individuals to his home and he has them wash cars without paying them. An individual's sister asks her to put her children on the individual's tax return and then asks for the money she receives from the tax exemption. Staff has an individual collect donations in the community for Special Olympics, then staff pockets the money. Failure to report. This one's a little bit weird too, and sometimes, just so you guys are aware, like, we might end up with a failure to report after the fact when we start looking at things, and it'll get added on to an incident. If we find out that, like, staff knew 5 days ago and didn't tell anybody, or just kind of took that information and put it away. So a lot of times this one kind of comes up after the fact. And in my own personal work history, I've had things that were like really little MUIs that were like a category C end up and result in people getting fired because they failed to report it when it occurred. And so the person that didn't report was in more trouble than like the original incident in person. Failure to report is a person who is required to report per the Ohio Revised Code. Per the revised code, has reason to believe an individual has suffered or faces a substantial risk of suffering any wound, injury, disability, or condition of such nature as to reasonably indicate abuse, misappropriation, exploitation that results in the risk to health and welfare or neglect of that individual. And such person does not immediately report such information to law enforcement agency or a county board. This includes information received while not being a paid provider or at work. This does not mean when staff fail to report an injury, unapproved behavior support, or unscheduled hospitalization. Some examples would be multiple staff witness a home manager physically intimidate, berate, and humiliate individuals in the group home and fail to tell anyone for fear of retaliation. An individual reports to day program staff that his roommate hits him and threatens to beat him up. The staff tells nobody, and the individual is taken to the hospital 2 days later after being punched in the face by the same roommate. Misappropriation is depriving, defrauding, or otherwise obtaining the real or personal property of an individual by any means prohibited in the revised code. Examples are an individual leaves his iPod in one of the rooms at the day program and returns to find it missing the day later. Staff uses an individual's food stamps to purchase several items for herself. An individual's pain medication is stolen from the locked cabinet in the group home.
And when we do get a report that something's missing or somebody reports something might have been taken, we do work with the agencies to ask them to look around. Maybe it was misplaced. When was the last time it was seen? Is it possibly that the individual maybe took it out in the community and maybe just lost it? So before we make a formal report of a theft, we go through some checkoffs there to make sure that we really have reason to believe that somebody stole this. Now with like cash and medications, we usually don't spend too much time waiting to make a report on those, especially if it's like a controlled substance, like a narcotic. We make sure that's reported because some of those narcotics can be abused, some of them can be sold on the street. And if we see there's been tight controls within the home with those medications and they've been doing all their documentation, and there's something missing, then we really have reason to believe then that somebody did take something.
Also, and just for some of the officers that might be taking the report, we sometimes, not we, but the group home or the individual's family needs that police report in order to get the prescription reissued or to have insurance even be willing to issue the prescription again without having to cover the out-of-pocket cost. And if it's a controlled substance, to even be willing to give them that additional 30-day supply. So they will be asking, and the pharmacy will typically require a copy of that police report in order for them to get that prescription refilled.
And that's the same with like if bank accounts have been compromised, the banks usually want a police report made so that they have something to go on, so that they know this report is really legitimate and somebody's not just, trying to get some money back because they decided to spend it somewhere they shouldn't have. So because we are seeing an increase in cyber related misappropriations where somebody's bank account says an Airbnb was used. The EBT cards, we're seeing a lot of transactions coming like from other states. There's a couple in particular that two separate individuals, two separate times. It was in a deli in New York City. That's where the EBT card was used, but there was no way anybody could have taken that EBT card to New York City and used it and come back because it was all under control. It was under somebody's possession. So we are seeing a lot of that. And a lot of times we don't have a lot of leads on, how that's occurring, but we just report it so the individuals, so they can be reimbursed for the funds that they've lost, and so that we have it on the record, so we can and do our report also internally.
And JFS is tracking the EBT stuff, but it's so far advanced and like so prolific that they're kind of at a loss right now as to, man, what do we do with this? Like, it's just get these forms filled out, get the police report, it all gets sent to JFS because they've seen like such an explosion of the fraud with EBT stuff and unemployment. I was a victim of unemployment. Nick was a victim of the unemployment one. So that's like something that our individuals get to see too.
Yeah, so neglect, when there's a duty to do so, failing to provide an individual with medical care, personal care, other support that consequently results in serious injury or places an individual and other person at risk of serious injury. And serious injury means an injury that results in treatment by a physician assistant, or nurse practitioner. So when we get reports of neglect, there's the obvious reports of neglect, like somebody leaving somebody at a rest area and driving away. Or somebody leaving somebody in a bed for so long they develop bed sores. There's other times where we get reports of neglect where we have to go back and look at the individual's plan and say, what does this plan say? How are they supposed to be taken care of? What risk were they at? And then we determine if we file the MUI internally or not. And we can go to the next slide. So examples could be neglect of supervision where there's a risk of harm. Staff leaves high-risk individuals alone in a group home for a half hour where the staff goes to get food for himself. Individual who requires 2-to-1 staffing for health and safety reasons is left alone with the staff for 2 hours. So individual with significant medical needs and no alone time is dropped off by transportation staff with no staff waiting for her in the home. Staff, this would be more specific for treatment for the individual. If they fail to fill a prescription, if the individual is showing signs of illness or maybe they had a fall and they're showing signs of like a head injury and not contacting 911 or not contacting their supervisor or somebody to get the individual checked out. If the individual is on a mechanical soft diet and staff fail to cut their food into appropriate size bites, resulting in an incident of choking. So when we get a choking incident, we'll go over that category more later. But when we get a choking incident, the first thing we ask is what were they eating and were they eating what they were supposed to? And then we go from there because we do find sometimes that staff are not following the diets. And then sometimes they are following it, but we need to fine tune it a little. And that choking incident is kind of a warning sign, that we need to look at this some more before we, go forward with their diet. And then prohibited sexual relations, DD employee engaging in consensual sexual conduct or conduct with a developmentally disabled individual who is not their spouse. So sometimes we get these reports either from a staff person, like a witness, or the individual divulges, that they're in some type of relationship with somebody, or that the staff are doing favors for them, which seem unusual, and then we find out that they're in some type of relationship. So we file that internally. We also ask the providers also to file that to law enforcement, because we don't know if it's actually abuse. We don't know how consensual it really is. And if it really is abuse that's occurring, we want to get to the bottom of that as quick as we can, and not just chalk it up as just, the staff and the person were in a relationship. So we would look at like the dynamics of that relationship, the age, and that sort of thing. Rights code violations. So any violation of individual's rights which creates a likely risk of harm to the health and welfare of the individual. We have a Bill of Rights for the individuals that all staff, all caregivers sign off on. If they violate those rights and it results in the individual having a reaction, maybe a behavior where they kick a wall and fracture their foot, or they go outside and then punch out a window because they're so mad, and have to get sutures or get treatment. We're asking, well, like, what happened before this? Why were they upset? What is it? Just because they were having a bad day, or did somebody do something that kind of set them off? With violating their rights.
Category B MUIs are attempted suicides, medical emergencies, missing individuals, non-suspicious natural deaths, significant injuries, and peer-to-peer acts. So a peer-to-peer act means one of the following incidents, involving two individuals served. So exploitation, which is the same as from the previous one. So with a peer-to-peer, it's a lot of the stuff that is in the category A MUIs, except it's two individuals that either live in the same home, reside in the same setting, go to the same day program, use the same sort of transportation, and have time together where they then take something that would be a category A MUI if their staff or provider were the one to do that act, and they're kind of against one another. So it's, the exploitation, which would be taking money, their property. I think but it's like a $25, isn't it? Something of over $25 in value. Or $20 in value. Sorry, I guess I needed to read down a little bit more. My bad. The theft, so like the intention, like intentionally taking someone's belongings, verbal abuse, so the words, gestures, communicative means to threaten, coerce, or intimidate. Sometimes we see that a lot, more than some of the other types. Sexual act, so that's without consent. I think sometimes people, this is just my own personal belief, individuals with disabilities are allowed to be in relationships. They're allowed to be in relationships with one another, and they're allowed to be in consensual relationships with somebody without a qualifying disability, as long as it's not their provider or staff. But if they're coming to you and saying, like, this person touched me and I told them no, this person kissed me and I told them no, anything along those lines is when it hits the peer-to-peer for sexual act. But I think sometimes older people kind of don't see their, 60-year-old daughter with Down syndrome having a boyfriend, and they question, like, is it appropriate? And we have to have that conversation. But if it's peer-to-peer and it's not allowed, and she's saying no, or he's saying no, we've hit peer-to-peer. Physical act is the physical altercation between the two of them, strangulation, bloody nose, bloody lip, black eye, anything that could result, like, incarcerated or subject to criminal charges.
Yeah, we've had cases before where individuals are, one I can think of, riding on the van and one individual hit the other one in the back of the head, and it didn't meet our criteria, but when the individual got home, they lived at home with their parents and said, so-and-so hit me in the back of the head. They were okay. I mean, I'm sure it hurt. And then the parents called and made a report and wanted to file charges. So then by default, internally, we have to file the peer-to-peer physical.
Okay. Go ahead. Good. Attempted suicide. This involves an individual's physical attempt at suicide, which results in one of the following outcomes: ER treatment, inpatient observation, and hospital admission. Take any suicidal talk or gesture seriously as they are a cry for help. So a lot of times we'll get questions about somebody saying something. Just if they have said it, it's not necessarily doesn't meet the criteria for an attempted suicide, but you still want to make sure that person's getting treatment and getting help, even if we're not at a category B. We'll let you guys know if you have a question about it, just send it in.
And we've shared the local registries for people that live in the community. So if we know individuals that are struggling, you know, either they're either physically aggressive toward others or suicidal, we're encouraging people to fill out that registry to give all the law enforcement agencies, you know, a heads up that here's who this person is, here's what they're dealing with, you know, in life. For the most part, most of the individuals we're dealing with are either the suicidal ideations, or they're trying to cope with struggles between them and their caregivers, and sometimes they're just reacting out because sometimes the caregivers are just a little too overbearing on them, so they're reacting to those situations. So we try to work with the staff as well to say, you know, here's the plan, here's what we're doing to work with the individual, and we don't have to go, you know, above and beyond with them. Medical emergencies. So any incident where emergency medical intervention is required to save an individual's life. This is for caregivers, staff persons that are working for an agency that are getting paid to work with an individual, and if they have to use back blows, Heimlich, use of an EpiPen for a bee sting, CPR, defibrillator. Anytime EMS or a law enforcement officer has to do this, we don't file an internal report. We have it as an incident report, and we log that and follow up on that to make sure the individual gets the care that they need. But this is only for when it's dealing with staff that work in the field. And then missing individual, an incident that is not considered neglect and an individual's whereabouts after immediate measures are taken are unknown, and the individual is believed to be at imminent risk of harm to self or others. If they have a history of sexual offending, dementia, mental health concerns, history of aggression toward others, poor pedestrian skills, inclement weather, or at the bottom there, it's hard to see if law enforcement is notified to assist in the search. So when we first get a report that somebody's not where they're supposed to be, for some people that would be they're supposed to be in this room, or they're supposed to be in this room or the next room. For other individuals, we have individuals that work here on the campus. They could be anywhere here on the campus. So we tell the providers, we tell the caregivers, put forth the best effort to locate the individual in the immediate vicinity, but don't spend too much time. Don't let too much time go by if you can't find them in that area that you think you should be able to find them in, and don't hesitate to call and make a missing persons report. Because for some individuals that maybe they're having a bad day, having issues with their behavior, and they take off. Sometimes if the staff follow them, they'll go further and further. So sometimes they just need to make that phone call to local law enforcement and say, I need help finding this person. I just saw them go across Route 76. You know, I'm going to stay here, or I'm going to go back to the house, you know, to help, so people can work together on trying to find the individual. And then non-suspicious natural deaths. Any death of an individual from natural causes without any suspicious circumstances. So if they've been hospitalized, or if they're on hospice, if they have severe pneumonia, if they have a heart issue and maybe in more recent days, there's been some signs and symptoms of heart issues, and they went in the hospital and came back out. So anytime we get a death report, we call the coroner's office first and talk to the investigator, because sometimes they're not notified and they're supposed to be. And then that way we can share our information with them, and then they can let us know what they have, just to make sure everybody has the same information, and then we can move forward with whatever type of investigation we need to do. Significant injuries, it could be known or unknown cause. So specifically what we file for is concussion, broken bone, dislocation, second or third degree burns, anything that requires immobilization or casting, or 5 or more sutures.
This one. Category C MUIs involve the team reviewing relevant documentation, information, and the SSA filling out the Category C form for an IA to review. These categories include law enforcement, charged, incarcerated, or arrested, unapproved behavior support plan, and unanticipated hospitalization. So with the law enforcement MUIs, it's an incident that results in an individual served being arrested, charged, incarcerated, and also tased. So if they get tased, that falls in here too. It just doesn't fit their little CIA anagram that they have, that's how we're supposed to remember. So we have to just remember tased. And then law enforcement. Man, you got me up here stuttering. I'm gonna sound like a rapper. That's fine.
And when there's an individual that's been arrested or incarcerated, if they have either have natural supports like family or a paid provider like through a provider agency, we make sure that they let law enforcement or the jail know like what their medications are, what their medical history is, make sure they provide all the paperwork that's needed, and let them know of any other concerns that might be necessary if they're actually incarcerated.
And if you guys did have an individual you were picking up, if you needed to reach out, like you could call after hours or something like that, and the SSA here could let you know if they have medication or something, if they were going to the jail.
Yes, it's actually our main number, which should be in this printout, and option 4. So during the day you would reach us, and then after hours it goes through an SSA on call, and they're on call from 4 p.m. to 8 a.m. the next day, or Friday through Monday morning on the weekends. So there's always somebody that can be reached, and they have access to the individual's information, and they're also their manager as well. And if there's any individuals that you come across that you think might meet the criteria for developmental disabilities, don't hesitate to call us, because it could be somebody who's moved into the county that we're not familiar with. Because some people move in and out of counties and sometimes their first phone call isn't to the county board. They just move counties and go along with, life and whatever it is they need to do. Or sometimes they move out of state and we're not aware of them, but we have a way to also go through an eligibility process as well to determine if they maybe had received services at one time, or maybe if they could receive services.
Unapproved behavior support. It's the use of an adverse strategy or intervention prohibited by the Ohio Administrative Code, or an adverse strategy implemented without approval by the Human Rights Committee or Behavior Support Committee, or without informed consent that results in a likely risk to the individual's health and welfare. These involve the use of physical, chemical, or mechanical restraints, as well as the use of timeout. Per DODD, any hands-on intervention utilized to stop an individual's behavior is considered an unapproved behavior support. Examples would be an individual's arms are strapped to his wheelchair on the bus in order to stop him from pulling hair. Staff holds an individual's hands down with resistance to keep the individual from engaging in SIB, which is just self-injurious behavior. Staff hold an individual's bedroom door to keep him in the room until he calms down. Staff gives an individual a dose of PRN Ativan without following the orders. Any restraint which exceeds the length of time approved in the behavior support plan is an MUI.
So for the unapproved behavior support, the only time you're probably going to hear from us is if we feel excessive force was used, or with the mechanical, like if somebody's tied to a chair, if they were to do that for with using force or with any period of time where it caused maybe some type of injury to them, that's when we would consider upgrading that to abuse or neglect.
Yes, Kim?
Do we maybe want to explain a little bit more about Human Rights Committee and as far as where it's housed in these getting approved?
Okay. So Kim is the head of our, no, look, I'm going to give credit where credit's due. So Kim.
I am Vanna.
No. Listen, that was not my intention. I'm sorry. I just want to give.
Okay. I'm the Human Rights Committee Chair, and so the Human Rights Committee is housed here at the County Board. There's different members from, there's guardians, individuals that we serve, staff from other agencies who are on this Human Rights Committee, and we have to follow the DODD rules on restrictive measures. So the SSAs will send the packet to me, and the Human Rights Committee has to approve or dissent for them to be able to do those straps and, hold people and all that. So it has to run through that. If it didn't, then that's when it's an MUI. It wasn't approved through us.
Thank you.
Thank you, Kim.
Any anticipated hospitalization, it's any hospital admission or stay over 24 hours that is not planned, unless that admission is due to a pre-existing condition, which is clearly specified in the ISP. So sometimes we're now seeing people that are in the emergency room for like 28 hours, and that does count, like it meets the criteria. So even if they weren't admitted, they were just there getting fluids, or they were doing like a short-term treatment that they didn't admit for, we would need you guys to send that in. After an individual, or after being in severe pain, an individual is taken to the hospital and admitted to have surgery, or for surgery to have a kidney stone removed. Following symptoms of a rapid heartbeat and labored breathing, an individual is taken to the hospital with a diagnosis and admitted with a diagnosis of pneumonia. An individual appears lethargic and is taken to the hospital and kept for observation over 24 hours. MUI categories that need reported for those, hold on a second. MUI categories that need reported for those with a 24/7 DD provider or DD provider is involved. Medical emergency, unanticipated hospitalization, significant injury, rights code violation, and unapproved behavior support. All other categories must be reported regardless of whether a DD provider is present or not. So sometimes we have like an individual that'll go home with mom and dad and end up hospitalized. And if mom and dad aren't paid supports, then we don't need the report. But if the individual is sick with the provider and then mom comes and takes them to the hospital, it still ends up getting screened in because technically they were with the provider, but mom stepped in and decided to take them, or dad or guardian or whomever. They were with the provider like when that decision was made for them to go to the doctor or the hospital. Reporting requirements. Immediate to 4-hour reporting is required for accidental suspicious death, abuse, physical, verbal, and sexual, neglect, misappropriation, exploitation, peer-to-peer acts, when a media inquiry is received regarding an MUI. So the 4-hour reporting is 24 hours a day, 7 days a week. You can call in when the main number during the hours that we're open. After 4 o'clock, you would do the on-call option, and that way somebody at the board has received that report within the 4-hour time period, and it's a 4-hour window from the time that you discovered or learned about the incident. Incident reports must be completed by any person who provides any type of service to an individual with developmental disabilities, even if they are not working at the time that they found out about the incident. A written report must be submitted by 3 p.m. the next working day. And then our email address is down here, and this comes to not only Nick and I, but also Sabrina gets it, and that way somebody is able to get eyes on it. And then we will follow back up either with a phone call or a responding email to let somebody know we've received it, and we're gonna work on it from there.
And for reports that don't come to us, that don't meet the criteria, the provider agencies are required to complete those reports, are required to keep a log of those reports, and we review those logs periodically.
And if you have a doubt, like if you're like, maybe it is, maybe it's not, just send it to us. We will let you guys know, especially with the car accident situation. If you have a question about it, just send it to us and we will let you guys know. We don't mind reading the email, and it's better to get it in and make sure that everybody's good than find out later that we missed something.
And a phone call to the option 4 is very much appreciated, because sometimes we're not staring at our emails. Sometimes the email doesn't go through. So we don't want to just like when we send something out, we just don't assume somebody got it. So the best way to make sure that your report is reviewed, especially if you think it might be a 4-hour type, is to call us and use option 4. The incident report criteria. So the staff that are trained to work in the field, we want a factual description of the incident, avoid use of initials and we or staff. So at least we want the staff to use at least staff's first name when they're doing the report. We want to know the who, what, when, where, and why, and cause and contributing factors that are known at the time, any type and location of any injuries, and then immediate actions taken to ensure the health and welfare of the individual. So in certain situations, staff, they might be calling the 911, they might be calling their nurse, they might be calling their supervisor to take care of the individual first, their health and safety first, and then that next phone call can be to us. The rule states a provider county board shall implement immediate actions to protect the individual's health and welfare. So examples would be, again, assessed for injury, initiated first aid, called 911, separating individuals, removing the PPI, the primary person involved, from the work schedule, or not putting that individual back into that environment wherever the alleged abuse allegedly occurred, notifying law enforcement and any other actions to keep individuals safe. And technically speaking, notifying us is not really considered an immediate action. Notifying us of what the incident was and what the immediate action was is notification then, so we have a heads up, so we know if we have an MUI to file or not. And then notifications of an MUI. Per the rule, the provider shall make notifications when the MUI or discovery the MUI occurs when the provider has responsibility for the individual, and this notification should occur the same day as MUI is discovered. So the guardian should be notified, the SSA, Service and Support Administrator here at the County Board, appropriate providers, family, and then law enforcement and JFS if applicable. And then we ask that not to notify or discuss the MUI with the primary person involved for obvious reasons. We want the first contact for them to either be law enforcement or children's services contacting them, or us contacting them to do a formal interview. We don't want them to know that there's any specifics about any allegations that have been made against them. In the law enforcement notification, immediately report to law enforcement any allegation of exploitation, fair to report misappropriation, neglect, peer-to-peer acts, physical abuse, sexual abuse, or verbal abuse, which may constitute a criminal act. Document the time, date, name of person notified, as well as the report number if applicable. And then if there's a crime in progress or immediate intervention is needed, contact the local police or 911, like for a medical emergency type situation. And then for JFS, abused or neglected children, all allegations of abuse or neglect as defined in sections 2151.03 and 2151.031 of the revised code of an individual with intellectual or developmental disabilities under the age of 21 years shall be immediately reported to the local public children's services agency. The notifications may be made by the provider or the county board. The county board shall ensure the notification has been made. And then also with that said, we still want to make sure that the immediate actions are taken. Just notifying Job and Family Services is not an immediate action. That's a report to be screened, either be screened in or screened out, but we still want to make sure those immediate actions are in place. And then the Medina County Memorandum of Understanding for cases involving abuse, neglect, exploitation, misappropriation, and death of individuals with developmental disabilities has been created. The MAU expresses a community commitment to respond to reports of abuse, neglect. It includes, but is not limited to, the county probate court judge, all law enforcement officers, Medina County JFS, coroner, municipal court judges, and victim advocate, etc.
The abuser registry. DODD maintains an abuser registry, which is a list of employees who the department has determined have committed one of the registry offenses listed below. If a PPI is placed on the registry, the PPI, which is the primary person involved, is barred from employment as a DD employee in the state of Ohio. Registry offenses include physical abuse, sexual abuse, verbal abuse, prohibited sexual relations, neglect, misappropriation valued at $100 or greater, failure to report, and conviction of certain criminal offenses. A substantiation is one of the above categories, does not automatically place an individual on the registry. That's a separate process conducted by DODD. Typically, like the abuser registry cases have the police involvement in it. We kind of get the notification, and then we let our area manager know, and they keep a running list of if the police have a open case, or the prosecutor's office has an open case regarding one of our individuals and their staff or their paid provider, and DODD tracks those to work with the prosecutor's office. It's something that's out of our hands to go from there to deciding maybe they can bypass the court system and the person will agree to go on the abuser registry in lieu of, a fine or whatever.
Yeah, we do the investigations, and then we don't make any recommendations. We don't make any mention of abuser registry. If we know there's charges being filed against the primary person involved, we notify our regional manager so that they're also aware, so they can start their process. And then they review basically all of our substantiated cases. We never know which one they're going to pull. They just contact us and say, we want this file, and we send it to them.
Data in Medina County. Physical abuse doubled down from 2021 to 2022, 8 to 16 cases. Relationship boundaries and unapproved behavior support gone wrong. Misappropriation has increased every year since 2020, online scams and catfishing, so there's a need to educate. And Medina County is one of the only counties that has the program through the prosecutor's office for the scam squad, which I think is really great. I used to work in Wayne County, and I live in Wayne County, and there was not really anything being done, but Medina County has a phenomenal resource, not only for seniors, but even just everybody. Like, I get 100 things a day, and probably half of them are scams. So that's something that we have that not a lot of other places around here have the capability of providing. And then unapproved behavior support has increased. Utilize de-escalation, redirection techniques first. Unusual incident reports. An unusual incident report form are to be filled out if there is an incident that is unusual. Example, staff is walking with the individual falls and scrapes their knee and it's bleeding. An independent provider needs to send UIR forms to the SSA of the individual who had the unusual incident. Then the provider is to mark this information on the monthly unusual incident report log. An agency provider does not have to send the UIR form to the SSA. They follow their policy at their agency. The provider agency will mark the UIR on the monthly unusual incident report log. They can email the SSA to make them aware of the incident. Prevention planning, key questions to ask. What happened? What should have happened? What were the causes and contributing factors? How do we decrease the chances of this incident happening again? How can we prevent injuries? Is there a trend and pattern present which needs to be addressed? 3 MUIs of a same similar category in 6 months, 5 MUIs in any category within 6 months, 10 MUIs in any category within 12 months. Elements of a good prevention plan: address each identified cause and contributing factor. Is specific. Identify who is going to do what, when, where, and how. Incorporates long-term planning, not just immediate actions. Includes input from a variety of sources, including individual, guardian when appropriate. Includes a plan for monitoring and reevaluation. The individual Bill of Rights is they have the right to be treated nicely at all times and as a person, have a clean, safe place to live in and a place to be alone, have food that is good for you, be able to go, if you want, to any church, temple, or mosque, be able to go to a doctor or dentist when you are sick, be able to have people help you with the way you walk, talk, do things with your hands, act, or feel if you need it, be able to have people help and teach you if you want, be able to have time and a place to go by yourself, be able to tell people what you want and be part of making plans or decisions about your life, be able to ask someone you want to help you, let others know how you feel or what you want, be able to use your money to pay for things you need and want with help if you need it, be able to say yes or no before people talk about what you do at work or home or look at your file, be able to complain or ask for changes if you don't like something without being afraid of getting in trouble, not being given medicine that you don't need, or being held down if you're not hurting yourself or others, to vote and learn about laws and your community, to say yes or no to being part of a study or experiment. Be able to call, write letters, or talk to anyone you want about anything you want. Be able to have your own things and be able to use them. Be able to have men and women as friends. Be able to join in activities and do the things that will help you grow up to be the best person you can be. Be able to work and make money. Be treated like everyone else. Not be hit, yelled, cursed at, or called names that hurt you. Be able to learn new things, make friends, and have activities to do and go out in your community. This is a list of resources that are helpful links if you guys have any questions about anything that was presented, or you just need assistance in finding something.
I think Zach's going to let us.
We're good.
So people have rights, and what happens if, like, they can't be alone, like a female can't be alone with a male? So we're going to restrict her rights, right? We can do that?
No, we have to come talk to you about it. And
So yes.
I'm gonna be like, hey, Kim.
Yes. We have to look at the
yeah.
risk. We have to
Right.
look at the risk of why are we not wanting this particular person around other people or what have you.
Is there a way that we can modify it so they can be alone? Maybe their staff is with them. Maybe they're able to use like FaceTime or something along those lines to talk to their peers or whatever.
But that also could be a rights restriction.
And you're going to tell us that, and we're going to fix it.
So that's why we want, that's why if there's an incident or a concern, we want the staff to communicate what's going on, or if somebody tells the staff to do something that deviates from their plan, we want them to not follow that. We want them to report it, tell somebody so we can talk about it.
Yeah, I just wanted to just state that, yes, individuals have rights, but sometimes for their safety, we have to restrict them. So
Right.
That's all.
I mean, and sometimes that comes like with food. People tell you they're not being fed, but they might be on like a restricted diet, or maybe like their food is locked up because they have a disability that causes them to like eat significant amounts of food and like overeating is a problem. So
Or choking.
things like that. My son will tell you guys that he doesn't get fed unless he gets pizza from Little Caesars 3 times a day. He gets fed. So.
And if nobody has any questions now, again, we're always available. If you call the main number, use option 4, or you can email us. Again, if it's an actual incident that you have a question about, follow the reporting protocol. If it's just a question about the interpretation of the rule, we're always available as well to answer that.
Nick, are you guys going to send this presentation out via email?
Yes, it should. It's my understanding it should have already been sent out.
Yeah, the PowerPoint for the next one went out. This one, though, you can send.
Oh, yes.
That way we can share with that.
Yeah. And just in the little bit of time I've been here, the officers we've worked with, because I know that sometimes like there's a lot of confusion about what each separate agency does. They've all been really receptive. Like when I've had to explain why I'm calling or why I'm asking for help, I haven't had any issues with someone being like, that doesn't make sense. They've all been very receptive and willing to help us.
Sometimes it's just a matter of trying to find out as much as we can and trying to explain it the best we can, of what's going on, what our concern is.
And answering to our regional manager, because she'll be emailing us questions and we got to be like, listen, hang on a second. And we got to reach out and ask. So.
Good job.
Thanks.
Thank you.
I got something to Q&A on.
Hold on, I'm getting a drink.
I had one job.
Oh, I thought I forgot. I thought it was
Oh,
Zach.
never mind. Or Zach.
Zach?
Freaked her out.
Oh, man. All right, we'll take a couple minutes so you get this in there. We can get started with the next set of data. We got a whole nother presentation. You guys thought you were running away.
Oh, yeah.
Oh,
You thought you were running away. Where's our snacks?
I have lifesavers in my
Yes.
desk drawer. Thank you, sir. Thank you. Okay.
back to 107.5. I couldn't resist. All right, so now we'll have our 2023 MUI stakeholders meeting. I would go around and have everybody introduce themselves, but I'm not sure who's there online. So we will just say we're going to go ahead and get started with this data, and thank you guys for coming back.
I was talking about something else, but I talk so loud anyway that it hurt me. Start. Okay. So this is the 2023 MUI Stakeholder Report. It's presented by myself. I'm Brittany, and this is my the other investigator in our department, Nick Pokaziwa, and Crystal put this together for us. I'm just going to give her a little like thanks for that. That's great. What we will learn, we're going to review the 2023 MUI numbers as well as the 2022 and 2021 MUIs that were reported and like see the difference in the fluctuation, and then statewide reporting rates compared to Medina County. Sorry. Category A MUIs, it's going to be death, accidental or suspicious, alleged neglect, alleged physical abuse, alleged sexual abuse, alleged verbal abuse, why can't I speak? Alleged verbal abuse, CODD cases, exploitation, failure to report, misappropriation, prohibited sexual relations, and rights code violations. So this is the chart of the category A MUIs. 2023's data is over here in the FAR category. As you can see, we're like really escalating. The top category is accidental and suspicious deaths. We had 5 on our report for this year. And I think that one of them, well, I know that one of them, we were waiting for the report to come back and it needed changed. But so for 2023, it was closer, three? It was closer to, we think it was 3 versus 5, just because it was in there, but still an increase from 21 and 22. Exploitation is 3, which that stayed the same from 22, but still up from 21, which was 0. Failure to report, we went from 0 to 2, which was also up. And then the misappropriation, we were at 21. And so that includes any type of their funds, including EBT, anything with like a cash value, their personal property, and actual cash itself. The neglect, we were at 21 for 2023, which was a significant jump from 5. Physical abuse, we were at 15 in 2023. It actually went down by 1. Prohibited sexual relations, in 2023, we were at 1, which was up from 0. And then rights code violation, we didn't have any, and we haven't had any. Sexual abuse, they're at 8, which was up from 21 and 22. And then verbal abuse was up 2 from 22 at 8, but down from 21 for a total of 84, which is up 30 category A MUIs from the last year. And I mean, you guys are gonna make me math. What is that, like 36 from 21? If I did that. Oh, I have it. And then forgot to change the page. So these are just in the charts with the accidental and suspicious deaths. Alleged neglect with the pretty significant increase. Alleged physical abuse, the same that we had just went through. And then sexual abuse. Verbal exploitation staying the same. Failure to report, misappropriation, prohibited sexual relations, No rights codes violations.
Yeah, so for category B, MUIs, attempted suicide, death other than accidental or suspicious, medical emergency, missing individual, significant injury, and peer-to-peer acts. Just wanted to touch base back on the previous slide with the death cases. I believe we had at least 2 that were ATV-related deaths. So we would like to provide any assistance or education and discussion with any individuals that, anybody that has questions about, safety and using ATVs. Again, we're here to answer questions. The individual's SSA and team, looks at those individual cases as well. So for attempted suicide, we had 3 for 2023. We had gone with 0 the year before and 2 in 21. The non-accidental deaths, we went from 10 to 12 down to 6 in 2023. Medical emergencies, we stayed pretty much the same, 6 and 4 and 4 in 23. We've been doing a lot more focus and education in prevention planning with the choking incidents. So we're hoping that's making an impact with our medical emergencies, keeping those down or lowering them. Missing individuals, we went from 6 to 7 to 13 in 2023. I can tell you, I personally know one individual that was responsible for the majority of those 13. It was considered a trend and pattern. Peer-to-peer exploitation, we went from 0 in 21 to 2 in 22 and 2 in 23. Peer-to-peer theft, we went from 0 to 4, back down to 0. For physical acts, we went from 12 to 4, down to 2. And with the peer-to-peer sexual acts, we saw an increase. We went from 1 to 2 to 14. And again, some of those numbers within the 14 are on the verge of a trend and pattern. Peer-to-peer verbal act, we went from 2 to 0 to 8. I believe some of that is an increase in individuals getting back out into the community to their day programs, but also we're seeing a lot more like electronic type communications between people, not just in person. And then significant injuries, we maintained, went from 23 down to 21, and then 21 for 2023. So for overall our category B MUIs, a total of 73. And then here's our numbers for charts with attempted suicide, the medical emergency, missing individual, non-accidental suspicious death, peer-to-peer exploitation, peer-to-peer physical, peer-to-peer sexual, peer-to-peer theft, peer-to-peer verbal, significant injury, and the category C MUIs. So unanticipated hospitalization, medical, unanticipated hospitalization, COVID, unanticipated hospitalization, psychiatric, law enforcement, and unapproved behavior support. So for 2023, we had a total of 59, so we tied 2022. For COVID, we went down from 6 in 21, 6 in 22, down to 1 in 23. And then for unanticipated hospitalization, we went from 4 to 9, back up to 11. For law enforcement, we had 11 for 2021, 6 in 2022, and 13 in 2023. Again, for the law enforcement type MUIs, we're trying to encourage people to sign up for the local registries for individuals so that local law enforcement and first responders are more aware of the individual and who they are and what their makeup is. And then for unapproved behavior support, we went from 19 and 21 to 28 and 22 and down to 24 in 2023. So we had a total of 108 MUIs for category Cs. And even if you even went back even further, except for COVID, if you went back further, you would see pretty much almost kind of the same numbers. The unanticipated hospitalizations is normally our largest MUI category. We have a lot of people with a lot of medical needs and issues, and some of them are living in intermediate care facilities, so they have more intense medical issues. So it's not uncommon for us to get frequent hospitalizations.
We've already seen like a decent chunk this year. We had one entire house taken out with influenza A. So
With one death.
yeah, with one death.
One resulted in a death. And that was in a place that is still tracking COVID and still following guidelines, and it just happened so fast. It all happened like at once.
Within like 24 hours, everybody in the home.
They couldn't do anything to prevent it.
Yeah.
So again, for this is our law enforcement graph. Unanticipated hospitalization, unanticipated hospitalizations medical, and then unanticipated hospitalizations psychiatric. And that's one reason why they put that 24-hour in the rule, because there was times where people were going and sitting at the hospital for days because for psychiatric reasons, they couldn't find a bed for them. So when the rule changed in 2019, I believe, they added that to it. They said either they're admitted, or if they're there for 24 hours or more, we're considering it, a hospitalization. Unapproved behavior support. And then here's a breakdown of our category types through the years. So last year we finished with 265 MUIs total. And then here's our statewide reporting rates. So we get a report from the Department of Developmental Disability. So they provide us with total number of MUIs, the total number of individuals served, and then the statewide reporting rate per thousand for 2023 was 195. And for Medina County, with 1,457 individuals served, our reporting rate was 176. Any questions about the data? We can go back if you want us to point out a specific category.
So just some of the specific trends and patterns I noted was for category A, there was a large increase in misappropriation and neglect. And there was also an increase in, like you said, the accidental deaths, and it was a coincidence that it was an extracurricular activity for both, I believe.
The ATV,
Mm-hmm.
Yeah, they were two separate,
Right,
completely different. Yeah.
So it's a misappropriation one that just kind of goes back to when we talked about in the first one with the increase in online theft, the increase in EBT fraud. So much of that, and like so many people just being like, some of the scammers are so convincing, or you don't even realize you're being scammed until it's too late. So that's like the biggest misappropriation one. A lot of people getting like friend requests through different social media platforms. Facebook Messenger is a giant one. And then a couple people through like adding people from Snapchat, and then them like, oh, if you give me $100, I can make it $5,000. Like, well, I mean, that sounds great. So it happens, and then that gets reported. And then the EBT fraud is a big one.
Yeah, we see EBT fraud that's like cyber related, but then we also have our EBT fraud where the pay providers are taking advantage of having that card on their person. And, as part of our rules and everything, that the staff are not to use those cards for anything personal at all.
Then for category B, I have a very large increase in missing individuals, and then peer-to-peer sexual acts and peer-to-peer verbal acts.
Yeah, we had one individual pushing our missing individual numbers up for last year.
And I should only discuss one of my guys, but his.
Oh, no, I'm sorry, two. There was two. That's right.
His numbers would also be some of the law enforcement, those would have some of those. Would have
Correct.
some-
There would have been law enforcement involvement, yes.
Some people just love the police and they go visit.
And then what was the other category?
So then the last, that was the missing individuals, then the peer-to-peer sexual acts and peer-to-peer verbal acts.
I know for peer-to-peer sexual, we did have kind of,
A lot more incidents where they just kind of had more access than they've had in the last few years. Things are starting to reopen.
and also educating individuals on boundaries.
Yeah.
Individuals thinking that they're in relationships and it's not a relationship, or it's not that type of relationship. And also the incidents happening like out in public, where it's not appropriate anyways.
Some of them were texting related too. Wasn't there like two that were
Yes.
through, electronics?
Right.
And then for category C, it looks like the law enforcement ones were the greatest increase, as well as the unanticipated hospitalizations per site.
Yeah, and the one missing individual law enforcement we were talking about that.
Look at that and take into consideration like one person.
Not all of them, but adding
Well,
one person contributing their fair share to
Yeah.
one category. Yeah.
Well, missing individuals generally speak, yours and someone else.
no, I understand that. I'm just saying, if you look at that and you think, is it a pattern? Because we're seeing, it's good to know that there's a few people raising those numbers, whereas you think,
They're sharing the load.
yeah, I mean,
Yeah.
I'm
Right.
saying that's important.
Frequent flyers.
Look at
Yeah.
those.
Yeah, and those are addressed individually, case by case, right? Yeah, and for this purposes, for this stakeholder, we don't get into the specifics of who it was or anything like that.
Can you go back to the one of the state comparison? Does anybody have any questions about that one, or where we were overall?
It actually appears that Medina County is doing better on the state, statewide averages, obviously. That's good.
Yeah, because some counties are kind of deceiving in their size geographically, but that's why they break it down to number of people served, so you have a better picture. Because some people think Medina County is big, they think there's a lot more people being served here, but those are the numbers. So that they give us a breakdown. The state sends us a breakdown where it's more detailed of each county, and how that all breaks down. This is just like the synopsis of that report.
But I think since I started in July, more people are moving into Medina County, was one thing that was talked about during my interview process. The number of people served by this county board has increased. People coming from Cuyahoga, coming from Summit, coming into the county. So like Medina's number of people served is also on the rise.
have any
As long as it's the people that don't have MUIs. Come on in.
Listen, because it's not like you didn't have a frequent flyer up there as well. And
Did we have any online
What I thought
questions?
was interesting was just
No, I
the
don't see any.
rights code violations being so low.
yeah,
Like,
So-
is that just because most of them don't.
Yeah.
Level of, like, you know.
and
danger to
and I
another person?
think that like once, right, and then the team can like go back and talk about it. Like maybe that person has escalated to a point, or it's gotten to the point where like you do have to have a hold or something put into place. So like those numbers can kind of decrease because it's been added into their plan since the MUI from the previous year.
And typically, we see where there's issues with staff and not following individuals' rights, what have you. It usually falls into another category. Like the way that rights code violation rule is written and the way it's interpreted, or at least the way we're told how it's supposed to be interpreted, that's why we don't have, well, for the past 3 years, we haven't had any rights code violations at the MUI level. Yeah, we could still have them at the UIR level where it would be addressed with the team and the provider. Like we wouldn't be investigating that. It would be addressed with the team. If the individual says, oh, I wanted to go to church the other day, but the staff said, I didn't eat my breakfast, so I wasn't allowed to go to church. There's no risk to health and safety. There was no harm, but it was still a rights code violation. The staff, the team then would address that with the agency or the provider.
Or that was the antecedent and they started walking out of the house and the staff grabs them and now it's physical abuse versus rights code violation.
Just for updates, the only thing I have is, as you guys stated already, we do have the scam squad in place for support for those folks that are receiving those electronic or virtual scams through email and EBT and other methods like that. We have the MOU, so for those of you that aren't aware, we have a memorandum of understanding that's shared throughout the county with the judges, JFS, and we're actually working with JFS to kind of streamline how we're reporting information and sharing with one another. We actually are planning to present to them next month.
Yeah, 15th.
So we're just trying to make sure that we're
Maybe it is 12th.
working together on all these
Monday.
different cases. And then we have the
8 a.m. on a Monday.
which, with all of Medina law enforcement to make sure they have that registry in place to be able to. I got to have my own mic.
I now apologize, Kim, for any discomfort with this microphone that I may have caused you. So the last thing we were talking about was the registry, just trying to figure out who all has one. So that's one of the things that Brittany and Nick and I are working on with Shannon in our administration office, just trying to figure out which counties have that reporting form. I think we discovered that the sheriff office has one.
Wadsworth has it.
Who
Wadsworth.
Wadsworth has one.
Medina City Police.
Medina City. So just trying to work with some of the other law enforcement agencies to make sure that that's something that's out there for everybody, because we do have a lot of individuals that aren't able to speak up for themselves if something were to happen. So it's a really good system to have in place. And then just next steps. I think right now we usually have this meeting once a year. So I don't know if anybody would like to have this meeting more than once, or if there's some additional trainings out there. But I think at this point, next steps will be for any families, any providers that want additional training on MUI to just reach out to us, and we'll come out. We can even come out to your agencies and do the presentation over the PowerPoint. Okay. That is all I have. All right. No one else has any questions? I don't see anything else online. Going once, going twice. You are all free to go get Dunkin' Donuts.
Good job.
Thank you.